The heart's venous system is like a complex underground network that most doctors overlook. But here's the shocking part. This hidden plumbing system accounts for nearly 30% of all cardiac complications during surgery.
That's such a fascinating perspective, and it highlights why understanding this system is crucial for patient outcomes.
Well, let's break down these three main drainage pathways, starting with what I consider the superhighway of cardiac drainage, the coronary sinus. It's remarkable that this single vessel handles about 70% of all cardiac venous drainage.
The way you describe it as a superhighway puts it in perspective. How does this impact our approach to cardiac procedures?
Well, here's a case that drives this home. I was managing a valve replacement where the surgical team was performing retrograde cardioplegia. The pressure monitoring showed some concerning patterns, and understanding the coronary sinus anatomy helped us identify a potential complication before it became critical.
That makes me think about the delicate balance we need to maintain during these procedures. What specific warning signs do you watch for?
It's interesting. We look for three key indicators: unusual pressure patterns in the coronary sinus, unexpected arrhythmias, and any abnormal bleeding patterns. I've developed what I call the traffic light system: green for normal flow patterns, yellow for subtle changes that need attention, and red for immediate intervention.
The way you're connecting these anatomical concepts to practical monitoring is really helpful. How does this knowledge translate to more routine procedures?
Let me tell you about something that happened during what should have been a routine central line placement. The pressure tracing looked almost normal, but something was off. Turns out, we had inadvertently cannulated the coronary sinus. This is more common than people realize, occurring in about 0.5% of central line placements.
That's a higher percentage than I would have expected. What specific signs made you suspicious?
The key was in the pressure waveform characteristics. We saw pressures about 2 to 3 millimeters of mercury, higher than expected for a typical central venous pressure, plus these subtle but distinct variations in the waveform pattern. But what caught our attention was when we started seeing occasional PVCs on the monitor.
Let's talk about those anterior cardiac veins. They seem to play a crucial role in right ventricular function.
Absolutely fascinating system. These veins handle about 25% of right ventricular drainage, bypassing the coronary sinus completely. In patients with right heart failure, this becomes incredibly important because any compromise in this drainage pathway can lead to rapid deterioration.
That brings up an important point about medication management in these patients. What's your approach?
Well, I've developed what I call the three-pillar approach. First, careful preload management, typically keeping CVP between 8 to 12 millimeters of mercury. Second, selective use of inotropes like milrinone, which has the added benefit of pulmonary vasodilation. And third, maintaining optimal positioning to facilitate venous drainage.
The way you're describing this makes me think about a challenging case I had last week with severe pulmonary hypertension.
Those cases can be particularly tricky because you're dealing with both increased right ventricular afterload and potentially compromised venous drainage. What specific challenges did you encounter?
The most difficult part was managing the hemodynamic shifts during position changes. Even slight adjustments would cause significant variations in our monitoring parameters.
You know what's fascinating about that? The Thebesian veins play a crucial role in these situations. These tiny vessels, which create about a 5 to 8% right to left shunt, become even more important when other drainage pathways are compromised.
Speaking of monitoring, what technological advances have you found most helpful in managing these complex cases?
The integration of real-time 3D echocardiography has been game-changing. It allows us to visualize these drainage patterns in real time, something we could only dream about a decade ago. Studies show it's improved our ability to detect venous drainage problems by about 40%.
That's remarkable progress. What final thoughts would you want to share about this often overlooked aspect of cardiac function?
Here's what I think is most crucial. Understanding cardiac venous drainage isn't just about memorizing anatomy. It's about appreciating how this complex system affects everything from routine anesthesia cases to advanced cardiac procedures. Recent data shows that incorporating this knowledge into clinical practice has reduced complications by nearly 25%.
That brings everything together nicely. Thank you for shedding light on this crucial but often underappreciated aspect of cardiac function.
You know what's exciting? As we continue to advance in medical technology, our understanding of these venous drainage patterns becomes even more important. It's one of those foundational concepts that just keeps becoming more relevant as medicine evolves.